So over the summer, I was in a sauna, decreasing my cardiovascular risk and reading some studies on my phone. Obviously, it was in airplane mode, so I wasn't frying myself with EMS. When I saw a really cool new study on nature.com showing that the ketogenic diet may enhance brain vascular function, increase beneficial gut microbiota, improve metabolic profile, and reduce risk for Alzheimer's disease. This was pretty cool. And then I saw that it was Dr. Lin, and I knew I had to read it. She had put out other great research that I was interested in. And when I got to the bottom of the paper, I realized, holy crap, Dr. Lin works a few hundred yards away from my office at the same university. So I had no idea, but I immediately emailed her, and we've been meeting since then and talking for a while. It's been really incredible to talk with her about this, and we want to share it.
You may have listened to our last episode on Alzheimer's disease, where we discussed the current best evidence as we see it. On that episode, we discussed the RECODE protocol by Dr. Dale Bredesen, which Matt and I support, but we've been talking to Dr. Lin about where the puck is going, not where it is now. So in today's podcast, we want to talk about where the cutting-edge science is showing and where it will be in the next few years. This disease, like we've talked about, is devastating, and the people suffering from Alzheimer's don't have time to wait. We need every bit of ammunition we can get.
And I've actually met with Dr. Lin's entire lab for lunch at the castle, and I just kind of really probably annoyed them and peppered them with questions about this. And then I've just been sending her questions as I think about them, because I'm really ravenous for this new knowledge that she has that other people don't have, because she really is making this science right now.
Hey there, I'm Mike.
And I'm Matt.
And I'm Jody. The Wild Health Podcast is our quest into human performance, longevity, and personalized medicine. Together, along with experts in these fields, we'll learn how to live longer, better, and become smarter and stronger. We'll do the deep dive into the research and hard work of putting it all together, and you reap the benefits.
So Dr. Lin, thank you so much for joining us. We've been just really excited to talk to you, and we're excited for other people to listen in on kind of what the future of Alzheimer's disease diagnosis and treatment is.
Thank you very much for having me, Matt. Yeah, thank you.
On our last podcast, we talked about how there's multiple causes that have been identified for Alzheimer's, like greater than 30, according to Dale Bredesen. Is there one risk factor that's more important than others, according to your research?
Yes, actually there's two major factors we know so far is most high-risk factor for Alzheimer's disease. The first is age, because we all will age, and aging is the highest factor right now we know leading to Alzheimer's disease. And the other one is genetic factor, is ApoE4 gene. So we know this gene is strongest genetic factor for Alzheimer's. And interestingly, these two factors are all related to metabolism changes. So we know that when we age, our systematic and also brain metabolism goes down. So we can lose our cognitive function, we lose our energy. This is all related to metabolic dysfunction. And ApoE4 genes, people who has this gene also have early sign of metabolic deficit. So even young people, young adults who are middle-aged adults, when we do a brain scan on them, we found that they already have reduced glucose metabolism early on. So we know now maybe these two, the major factor affecting Alzheimer's disease could be the metabolic dysfunction. So age and ApoE4 are the two keys.
Age and ApoE4, I think that makes sense. Unfortunately, those are two things that we can't really control. It's hard to choose our parents, and it's hard to not get older. The alternative isn't all that great. What are the top couple things you've seen in your research that we could do something about, the top couple risk factors?
Yeah, we all age, but we don't age equally. So there's a chronic age and also biological age. So even though a person with 40-year-old biological age, chronic age could be 30 or 50, depending on their lifestyle, depending on how they treat their metabolism. And we cannot choose our genes, right? So even ApoE4 carriers, they can avoid Alzheimer's disease if they have a good, proper lifestyle, healthy, proper lifestyle. So the key thing is how can we maintain our metabolism over time? So definitely lifestyle, diet, exercise, good sleep, all good, positive thinking, social activity, all the things can really protect our brain function. So that's what our research is really focusing on. How can we using diet or proper lifestyle can extend longevity and even extend health span? So we have been doing caloric restriction is a diet they know has been extend longevity. And also rapamycin is a medication that has shown that can protect the metabolic function over time and thus extend longevity in animal models. So all this thing we have been focusing on in our lab is maintaining metabolism over time with age, and even in ApoE4 carriers in a mouse model with ApoE4 genes, if we maintain their metabolic function properly, they can live better, perform better cognitively. So that's what we found so far.
And it sounds like, so the RICO protocol that we talked about on the last podcast, that basically does that, right? I mean, so you agree that's a pretty good starting point for people. Yeah. I had a patient yesterday who we were talking about, looking at all of his labs and the problems he had with them and how to change it. And it really came down to his insulin resistance. Right. And that's, I mean, that is the, if you had to describe in one word, preserving metabolics as you go and aging properly, that's a good way to do it.
Yeah. So actually, RICO protocol is very good. It takes it into a very holistic, systematic examination of this person's metabolic profile. And we know metabolic dysfunction also lead to inflammation.
Is there anything regarding the new dental?
Oh yeah, definitely. So there's a second question about gut microbiome, right? Microbiome actually play a big role in determining metabolic and inflammation outcome. So bad bacteria in the oral cavity or in the oral system, they can transfer to the brain and cause inflammation up there.
I've seen a lot of that in the news just recently, and hadn't heard of the connection between like bad oral hygiene connected to Alzheimer's. Jeez.
Yeah, so actually I talked to one of our clinicians in Alzheimer's disease center here, and he said that almost every Alzheimer's disease patient, they have really poor oral health.
As soon as I read it, I got excited and was like telling everybody about it. And my brother-in-law was like, now that I think about it, my grandpa had Alzheimer's and had no teeth. He said maybe that was related. I was
they
I'm
are.
not sure, but I saw they had like narrowed it down to like one specific strain of bacteria that they're thinking is causing most of the issues.
Yes,
that's crazy. And even then it was like, don't go too crazy, because if you brush too hard and start bleeding, you can get into your bloodstream. And I was like, oh my gosh.
There's always balance. We're talking about balance here. Metabolism is a balance. Yeah, you don't want to go either way, too extreme.
And the first thing was like good diet, and good exercise, and good social habits, and I don't have any of those. So, man,
you can at least floss some then.
Exactly. So I'll just sit at home alone and brush my teeth. Yeah, I'm good.
At least a good start.
Dr. Lin, are there any theories into how mechanistically ApoE could be having its effect on metabolism in Alzheimer's disease?
Yeah, actually ApoE4 is a metabolic gene. So it calls ApoE is apolipoprotein E. And this protein is a lipid transporter. So it can its function is transfer cholesterol outside of the stream. So ApoE4. So ApoE has 3 alleles: E2, E3, and E4, and they only have one amino acid difference. So ApoE4, because of this one amino acid difference, so the structure of this protein become different, very narrow. It's like a hook, and then so it cannot bind with the larger lipid like HDL, high density lipid protein. It only can bind with the LDL, and then once it bind with this bad lipid LDL, low density protein, then it becomes sticky and to amyloid beta. So it will kind of clump with amyloid beta like a snowball, going in the brain, and then become plaque deposit in the brain tissue. So that's the potential mechanism that enhance the risk for Alzheimer's disease. And also because it binds with LDL, so the ApoE4 carriers has higher LDL concentration in the blood. They also increase the risk for cardiovascular disease and stroke. So not only Alzheimer's disease, so ApoE4 is also high risk for cardiovascular disease. And also ApoE4 carriers also have higher glucose insulin resistance and glucose intolerance. So there's a few things come together make ApoE4 is high risk genetic factor for Alzheimer's.
I feel like I've read previously before that ApoE is sort of a pro-inflammatory molecule. Can you speak to that? How does it act to increase inflammation?
Yeah, so especially in the vascular side, ApoE is secreted by the glial cell, right? So when it comes out, it will activate. So ApoE3 and ApoE4, because they ApoE2, because of their structure, they can activate. They can inhibit NF-kappa B. This is an inflammatory marker, and it will shut down that pathway. ApoE3 carrier can shut down that and shut down the MMP9 inflammatory pathway. But because the structure of ApoE4, it cannot do this. So it kind of not only cannot inhibit it, it can facilitate this pathway. So down the road is kind of in the blood vessel, it can disrupt blood-brain barrier. So once blood-brain barrier is disrupted, then you can imagine other inflammatory cytokines that flood into the blood and also pass through that into the brain. So that's another way that ApoE4 increase inflammation.
So that's a few different mechanisms that ApoE could be increasing your risk for Alzheimer's and cardiovascular disease. The accumulation of amyloid in the brain as well as inflammation. Are there any specific interventions that we can employ, thinking of those two mechanistic etiologies, that would help ApoE carriers from having these effects?
Yes, definitely. So one thing, there's two things we think we can do right. Actually, three. Sorry. So from dietary perspective, ketogenic diet could prevent this, because in our study we found that actually feeding ketogenic diet, even with healthy mice, not ApoE4 carriers, they really protect their blood-brain barrier function, reduce their inflammation, and enhance their cardiovascular and cerebral vascular function. We discussed this in our paper. And also the other thing is modulate the gut microbiome, because we know gut microbiome play a big role in determining metabolic function. So in this current study we're working on with the ApoE4 mouse model, we just treat them with prebiotic diet for 4 months, and we see dramatic shift of metabolism. So these mice, they have increased mitochondrial function with enhanced TCA cycle flux, and also the pentose phosphate pathway is another pathway related to glucose metabolism. All these two pathways are increased, and also their neuroinflammation gene expression goes down. And the other thing is their gut microbiome, because the shift of gut microbiome, they have increased lactobacillus and other beneficial gut microbiome that also help increase short-chain fatty acid production. And we know that short-chain fatty acid actually protect glucose homeostasis and can help increase insulin sensitivity. So all this changes because of the diet, and the ApoE4 carriers, the mice, really doing much better than the control diet mice. So, yeah.
So some of the work out of your lab has identified specific fiber sources that may be beneficial in Alzheimer's. Do you think the effect from these dietary interventions is due to a reduction in gut inflammation or a specific bacterial byproduct from feeding the right bacteria? Or do you think it's some other mechanism? And specifically, what fiber is it that you guys were studying?
Yes, I think it's a combination of metabolic preserve metabolic function and reduce inflammation. So this fiber is a prebiotic fiber. It's called inulin, and inulin is can be found in our food like sugary root, onion, asparagus, and banana and leek. So we all can find this in our natural food, and also in some of the product of probiotic product, it also contained in it. And this fiber is very special because it's non-digestible fiber, can be fermented in the gut. So it can help stimulate the growth of beneficial gut microbiota, and on the other hand, kind of reduce the amount of harmful bacteria. So this diet, this fiber is very helpful, and as I just addressed previously, this fiber help protect their mitochondrial function, reduce neuroinflammation, enhance beneficial gut microbiota production, and also enhance short-chain fatty acid production.
Sorry, I was gone there for a minute. We're recording at our downtown clinic, and somebody came and grabbed me because somebody was in distress. But the paramedics have him now, so I think he's going to be okay. And I'm back. So unfortunately, I hope I didn't miss anything really exciting, but I'm sure I did. What were you going to say, Mike? I've got a few questions too, and if I ask one that you've already asked, just let me know.
Yeah, we were talking about the mechanism about which ApoE increases your Alzheimer's risk, and then about some of the specific things you can do to reduce its effect on Alzheimer's disease risk. Specifically, Dr. Lin mentioned the ketogenic diet, as well as altering the gut microbiome with prebiotic inulin ingestion. One quick follow-up to the ketogenic diet recommendation. I know some patients with ApoE have a negative response to a high saturated fat ketogenic diet with elevation of inflammatory markers and marked elevation of LDL cholesterol. Have you seen a similar response in mice with ApoE4, recognizing, of course, that it might not cross over from mice to humans?
Yeah, we haven't done ketogenic diet with ApoE for mice. We only did that with the healthy C57 black background mice. So that's our next step, to look into how ketogenic diet will affect ApoE for transgenic mice. But the other study, there's one study just recently published, very interesting. They found that ApoE3 and ApoE4 carrier mice, actually they have different amount of transporters, glucose transporters and ketone body transporters. They found actually ApoE4 transgenic mice have higher amount of ketogenic transporters, ketone bodies transporters in their brain. So actually, by their theory, it's like ketogenic diet might be even more beneficial for ApoE4 carriers. That's recently found in animal model, but this hasn't been validated in humans. So we would love to see that.
And I think Mike and our reading of the literature is that ApoE4, we understand for Alzheimer's disease the benefits of ketones. I think. Correct me if you disagree, Mike, but I think we'd recommend high-fat diets frequently, but more polyunsaturated or more extra virgin olive oil and things like that instead of saturated fat from animals if it's an ApoE4 carrier. Do you have any other thoughts on that, Mike?
No, that's my standard. My understanding of the literature is to move towards plants and monosaturated, polyunsaturated fats for those patients with Alzheimer's or Alzheimer's disease risk, as opposed to a high saturated fat diet. You still get the benefits of the ketogenic diet without the potential cardiovascular disease risk from the negative effect of the highly saturated fat diet, whether that's from ApoE4 or PPAR gamma or alpha, whatever potentially causing the lipid abnormalities.
Yeah.
And we've talked about, Dr. Lin, you showed me kind of preliminary data, and I was kind of shocked with how big of a correlation there is between metabolism and Alzheimer's disease compared to amyloid beta and ApoE4. I think everybody thinks of amyloid beta as, that's Alzheimer's disease, but that was kind of way down the list, and I think we all agree at this point, and I want to get your opinion on that, amyloid beta really isn't a cause, it's kind of a byproduct. And I was just surprised at how much higher the patient's metabolism and their glucose metabolism in the brain correlated with Alzheimer's than those factors, the things that we classically think of.
Yes, so that's to our surprise as well, because right now everybody think amyloid beta is a hallmark. If you have this in your brain, then you definitely get Alzheimer's. But actually, it's found that it's very high false positive rate for using amyloid beta as a marker for diagnosis of Alzheimer's, because a lot of people have amyloid beta in their brain, but they cognitively normal over their lifetime. So there's definitely not, amyloid beta is not a marker for Alzheimer's disease. And that kind of is more like the end product or the debris of this disease. So that's why we trace back, see what's really may be a real cause of this disease. So when we look into the big data set from the NIH database, they have this longitudinal cross-sectional imaging data, cognitive testing data, and we using machine learning method to sorting out what's the highest ranking imaging marker related to their cognitive function. And to our surprise, glucose uptake imaging data is always on the top and outperform amyloid beta marker. So that's really convinced us that actually metabolism is the thing we should focus on, because this is big for truth is why all the clinical trial failed so much recently. Almost 100% clinical trial for treating Alzheimer's disease fail because they're always targeting amyloid beta. So because we are targeting the wrong marker, so definitely there's no success for Alzheimer's treatment. So what we are doing right now is, in addition, rather than treatment, we are thinking about prevention. If we know metabolism is really the key thing, and can we do this early enough and to help people maintain their metabolism, maintain their lifestyle, and whether they are ApoE4 carrier or not, we can help them to know they can prevent getting this terrible disease. That's our goal.
Yeah, amyloid beta, it's kind of to me like when I hear people talk about it as a cause, it's almost like you come up on a house that's burned down and you're like, what caused this? And like, well, look at all this ash laying around. It must be ash that caused the fire. But no, it's the end. It's the end product.
Yeah.
And you mentioned a study, you shared a study with me that kind of blew my mind from UC Davis and UC Berkeley when we're talking about metabolism. So they did this PET scanning related to metabolism. Mm-hmm. And this scan could diagnose AD with 82% sensitivity and 100% sensitivity 75 months prior to the final diagnosis. And this was a small study. Obviously, anytime you see 100% sensitivity, that means the study is just not big enough because you would definitely miss some in the end. But those were amazing numbers, like super accurate 6 years earlier than any clinical diagnosis or signs. That's unbelievable. Like, can you explain this study a little bit to us, kind of what scanning it was and what you think its implications are?
Yeah, so they're also using the same NIH database I just mentioned. This is open source, so everyone can get into it and get the data out. So the good thing about this database is they have longitudinal collection of their brain imaging with metabolism using PET. So they look into the 6 years changes of metabolism and then the final ending cognition diagnosis. And they're using this deep learning method to classify the imaging according to different groups: cognitive normal group, mild cognitive impairment group, and Alzheimer's disease group. And to their surprise is that the PET imaging, the glucose uptake imaging, they acquire 6 years prior to the diagnosis of Alzheimer's disease, already can precisely predict or highly correlated with their cognitive function 6 years later. So using their imaging, they already be able to classify their potentially cognitive decline. So that's the importance of this study, using PET imaging collected 6 years prior can already kind of predict.
It was impressive results. And anytime I see a study like that, I immediately start thinking about my patients. And to me, anybody with I just immediately thought of my mother, who's an ApoE4 carrier, and just I immediately started wondering, how much does this cost? Will insurance pay for it? Like, this seems like something that anyone that's higher risk would be incredibly helpful to get, just prognostically, to see how much we really need to focus on the metabolism interventions. How much does insurance cover this? Do you know? Like, how much is one of these studies to do?
To my knowledge, I cannot speak from the clinical standpoint, but to my knowledge right now is more cover, the insurance potentially not cover it if it's not for diagnosis for cancer or specific disease. If you just want to know your brain health, the insurance may not cover it. And we usually scan people's brain is for research purpose. We want to know how metabolism related to cognition, so we recruit volunteers to do this brain scanning. But I really hope we can do this more universally, generally, to everyone in the future, so they can have a track of their brain metabolism changes over time, and they know if there is something already happening for their brain metabolism, we can have intervention for them early enough.
So do you have any idea how much this costs?
So for research purpose,
okay.
For clinical maybe higher, but for research right now is about $1,000 per scan, because it involved in radio tracer, which is pretty expensive to produce from cyclotrons. Yeah. Yeah.
So, and you said that the UK, where both of you and I work, they have one of these, right?
Yes.
Okay. So I'm going to look into that, because honestly, I want to look into this data a little more. Obviously, more studies need to be done, but this, I don't want to be. This seems like something that we may be doing 5 to 10 years from now, if these studies play out and we get bigger studies, and it looks like, and it proves to be what it looks like now. So I'm going to investigate this a little more, find out a price, and we'll kind of follow up with you on that as to whether we think clinically this is something that we could use now.
Right. Great.
And just to back up for a second, we're talking specifically about glucose uptake and its relationship to altered metabolism. So does that imply that the mitochondria are actually broken and the cells aren't taking up glucose as would be expected?
Yes, correct. So there's a term about Alzheimer's disease, is type 3 diabetes, which means that the brain has insulin resistance. So that's why the glucose cannot be effectively taken up and to be utilized to generate energy substrate for the brain. So think about type 2 diabetes. They have this insulin resistance. So whatever they eat, they cannot be effectively converted to the energy they need. This is the same thing for the brain for Alzheimer's disease patient.
Okay, so the mitochondria are functioning. It's just that you can't get the glucose into the cells appropriately.
Yeah, that's in the beginning. The mitochondria are still properly functioning. Glucose cannot get into it. But for the long term, mitochondria also can be damaged because lack of energy supply can increase the oxidative stress. All this oxygen cannot go through the mitochondria effectively, then become the free radical particles that can damage mitochondria long term. So, yeah.
And that would make sense as to why exercise and the ketogenic diet both seem to help Alzheimer's prevention, because both of those things we know have a remarkable effect on insulin resistance.
So if you were to choose which interventions to apply first, I mean, I think we have some thoughts on this, but from your research, if you had to pick which interventions to apply first in kind of a mild cognitive impairment, MCI patient, what order would you intervene just based on what you've seen and what you know and all this other data that's actually not even published yet?
Yeah. So from my perspective, maybe ketogenic diet and this prebiotic diet could be the top two I will go into. But as we talked about in the past, it's like right now we are moving into precision nutrition approach because everyone do not have the same effect, even have the same diet. We really need to look into their host genome profile as well as their gut microbiome profile before we can give them the best recommendation about their diet. So our lab is really moved toward into precision nutrition will be the next thing. And I know Matt is working on that your clinic is really moving toward that direction. And I think that's the future of medicine.
Yeah, and it's complicated. I mean, you talk about the ketogenic diet, and if people just heard that word, they're going to eat super high fat, but they're not going to get the inulin and the things like that, the vegetables, because they're going to be trying to steer away from that. So I'm glad you mentioned that, also the prebiotics as well. So it is complicated, and it's hard too for when you think about Alzheimer's patients to get them to do a very specific diet and teach them all the things. It's really difficult, and that's why, in my mind, I'm so excited about this kind of PET scanning, because once someone has a disease, to get them to follow a strict diet like a ketogenic diet and eat their vegetables and things like that, it's nearly impossible. But if you can identify these people at really high risk very early, they still do have the cognitive functioning at that point to pay attention, to understand how serious it is, and to maybe follow a restrictive diet that's going to give them another decade of good brain health.
Right. Yeah, I want to follow up that point is that Alzheimer's disease doesn't happen overnight. You already have 20, 30 years lead time before the onset. And during those 20, 30 years, we really can do something, help them to get away from Alzheimer's disease. So I think if we can, using whether imaging or effective nutrition diet, we should using that to help those who are at high risk, and during those 20, 30 years, really help them to get back on track with a functioning metabolic function.
And that's why I'm really excited about your research and getting the word out about this, because I have this conversation quite frequently with people when we talk about genetic testing and the ApoE4 status. And a lot of people still are like, I don't want to know. I don't know if I'm going to get it. But as we get the word out that there is something you can do, like you just said, then I think that just is completely different. You give people hope instead of thinking about it as a black box that they're scared of and they just don't want to know.
Yeah, I really want to emphasize this point is that ApoE4 does not necessarily get you Alzheimer's disease. It just increases the risk. But if we can really know how to treat our metabolism well, every ApoE4 carriers can avoid Alzheimer's disease. Because in one meeting, I was so heartbreaking. Is that a person saying that he knows he has ApoE4, and he immediately cried. He says, "I'm dying with Alzheimer's disease." In my mind, I say, "No, you're not. That's not your destination or verdict. You have a way. Your life is under your control. It's in your control if you know how to do about it." So, which is focusing, maintaining your metabolism function. So that's the message I want to get out.
Yeah, and so anyone listening that's got family members that are at risk for this, if you're at risk for this, read some of Dr. Lin's research on the things you can do, and read The End of Alzheimer's, which we mentioned in our last podcast, because there is hope. There are a lot of things you can do. So don't just roll over with this disease. We all need to be fighting back as much as we can. So thank you so much, Dr. Lin, for coming on.
Thank you so much for having me.
And you just spent an hour with us, so we appreciate that time. But thank you for the years that you spent dedicated to finding these answers for us. We're just trying to translate it and get the word out, but you're doing extremely hard work. So we really, really appreciate that.
Thank you so much. I appreciate it.
We hope you like listening to the podcast as much as we like making it. If you think it's valuable, share it with somebody. Send it to someone you think would really benefit, and leave us a 5-star review in iTunes. Those reviews really, really help us out. Find us on Facebook and follow us on Instagram at WildHealthMD. If you didn't like, well, why are you still listening? Email us and let us know what we can do better. But the best way you can thank us for our time is to leave a review and share. Until next time.